Okay, perfect. So, hi, my name is Vaishnavi, and I am the CEO and co founder of Outreach for All, which is a youth led nonprofit based in Prosper, Texas, that works to reduce healthcare disparities.
Hi Vaishnavi, so wonderful to know you.
Hi, it's nice to meet you as well.
Yeah, so how since how long you have been working on this project of yours?
So, I started it with my friend about 1 year ago. So, it's been about like a year and a half since we started it.
It's wonderful.
Yeah. So, I don't want to waste too much of your time. So, I'm just going to go ahead and start with the questions.
Yeah,
So,
sure, definitely.
My first question for you is what inspired you to pursue a career in mental health?
That's a lovely question, close to my heart, because my grandfather, he was an Ayurvedic doctor, and my grandmother, she was an incredibly kind and generous woman. So my journey was deeply influenced by my family. And I believe my passion for healing and compassion truly started from there, seeing them, both of them, growing with them. And growing up, I also saw my father, who retired as a head of surgery. He's still working, he's still helping people. So he dedicated his life to medicine. And my mother was someone who was always there to support and help others. So their value of service and empathy naturally shaped my outlook towards life. And beyond this familial influence, I had an innate curiosity about human emotions, behavior, and I was always drawn to understanding why people think the way they think, why they feel the way they feel, and why they act the way they act. So this led me to pursue psychology, and this is where I found my true calling, and helping individuals navigate their challenges, heal from their past, and discover their strengths at the same time.
I think that's such a cool way of looking at it, especially by being influenced by your family. I think for me, I also want to go into the healthcare field, but surprisingly, my family doesn't exactly have as many doctors in it. So I think I was always influenced by external perspectives, but I think it's really cool that you were influenced starting from your childhood to go into it.
Yes.
And I think your work is amazing. So definitely that as well.
Oh, that's so wonderful of you to say that.
Of course. And then can you share your educational and professional background in this field?
So, yes, it is quite sparse, and it is quite extended along the cities and countries. So if I talk about my educational background, so I have done my post graduation as in clinical psychology, and clinical psychology is one of the main subjects. And then I did my PhD, where I studied about suicide in clinically depressed and schizophrenic patients. So basically, my work is around clinical field of psychology. Then I have worked with various psychiatrists in different hospitals and gain a lot of knowledge and understanding from there. And I have kept developing myself by doing observerships, internships in Nimhans, Wimhans in Delhi, and I also kept working in all the cities I moved around India, and then here now that I'm based here in London, UK. So I have worked in hospital settings, I have worked in school settings, in colleges, conducted workshops for parents, students, teachers, and during COVID, as everything came on online, so I again indulged myself by doing webinars and giving courses to people, and at the same time, increasing my knowledge by doing some professional development courses. So I think this is my educational background, and I'm also a hypnotherapist. So I have done my practitioner course from NLP Center, New York, and various other. I've trained myself in various other modalities to different courses across the globe.
Oh wow, I think that's really cool that like even during super hard times such as COVID, like you continued to find ways to make the best of it and help as many people as you can. I know that like
Yes.
COVID kind of made everyone want to like just relax and not do a lot because of how harsh it was.
Yes, yes. And actually, that was the time that really helped me in my personal growth as well,
Mhm,
because I volunteered in different causes at that time.
mhm,
Online options were available, and that volunteering actually gave the meaning and purpose during those hard times. So it was
mhm,
really nice to be growing personally at the same time
mhm.
and helping people as well.
I think that's amazing.
Thank
And
you.
then my next question for you is how has your perspective on mental health evolved over the years?
Yes, so it has been difficult, but at the same time, it has helped in my ongoing learning with all the experiences I gained during over the years. So my perspective on mental health has evolved significantly through both clinical experience and my ongoing learning. So early in my career, when I started as a psychologist, I viewed mental health primarily through the lens of diagnosis and symptom management. But with time, working with people, I have come to see that it is a deeply personal and holistic journey rather than just the absence of illness. So, through my work in psychology and hypnotherapy, I have gained a profound appreciation for the mind body connection and the role of subconscious patterns in shaping our emotions and our behaviors. So now I emphasize personalized therapeutic approaches, recognizing that healing is not just one size that fits everyone, it is every
Mhm,
individual according to their needs. And also working with diverse populations. I have worked with children, young adults, adults. It has deepened my understanding of how various factors like cultural, society, and generational factors can contribute to mental health challenges.
I think that's definitely very interesting. I know that I've talked to like a lot of like young adults and like students in my school about mental health. And I think definitely a lot of them think of it as just being like one part of your body. So it's just an issue with your mind. And so they're not really seeing like
Yes.
the full connection and how it influences not just your mind and your body, but it also influences like the people around you and like your behavior and attitude towards life and different things like that. So I think it's definitely important to like emphasize that part of mental health because it, like you said, it's not always linear and it's really dependent on the person.
Yes, and that is what I have learned through time, because
Mhm,
earlier when I started as a student, I had the same mindset,
mhm,
just going for the symptoms, going for the diagnosis, but then gradually I realized it is much more than that.
mhm,
And my perspective has also been shaped by the increasing recognition of trauma informed care now. You
mhm.
must be aware of that.
Yes.
The neuroplasticity of the brain and
Mhm,
the holistic well being. So, I also strongly believe in integrating evidence based practices, but
mhm,
with compassionate, client centered care to support individuals in their healing and self
mhm.
discovery.
I definitely agree with that because I feel like sometimes like it's not always just, oh, you have a mental health condition, here are like some medication or here's a treatment for that, and then now you're all better. It's often not like that because I feel like for a lot of individuals with mental health conditions, even if you're getting treatment towards that mental health condition, there's still so many external factors that also need to kind of be integrated and kind of like fixed before you can consider yourself fully healed.
Yes, yes, definitely. You have explained it so nicely.
Like definitely like connections with family, friends, things like that are also lost in that process. And so like fixing those would definitely be a part of healing.
Definitely. I totally agree with that.
And then what would you say is the most common misconception about mental health?
During my practice and while interacting with people around, yes, there are a lot of things that we can talk about here, but let me pinpoint the most common ones here. So many people see mental health issues are a sign of weakness.
Mm-hmm.
So this is the one of the biggest myths, that when you are struggling with mental health, it means that someone is weak or incapable. But in reality, if we look at it, it really takes strength to acknowledge struggles and then seek help.
Mm-hmm.
Then another myth, another misconception around is that therapy is only for people with severe mental illness. It's definitely not the case. Many people assume that therapy is only for people who have been diagnosed with clinical disorders. But no, therapy can help people with everyday challenges like stress, relationship, self confidence, if you are facing career growth issues, and your emotional well being as well. Then people say that, like, someone comes with a mental health issue, and the person says that just snap out of it,
Mm-hmm.
just think positive, just come out of it. Why are you just thinking
Mm-hmm.
negative? So it is not the case. Mental health concerns are not just about mindset.
Mm-hmm.
See, they involve neurological, emotional, and behavioral factors. And
Mm-hmm.
all need to understand that healing takes time and it requires the right strategies and professional support as well.
Mm-hmm.
And most people also feel that medication is the only solution.
Mm-hmm.
Yes, it helps. Yes, it definitely helps in many of the cases, but it is not the only approach. Psychotherapy, lifestyle changes, hypnotherapy, mindfulness, and there are many other holistic methods which can play a crucial role in improving the mental
Mm-hmm.
well being of a person. And one of the most important misconceptions that people talk about is that talking about mental health makes things worse.
Mm-hmm.
That is not the case. So some people fear that if they are going to discuss their struggles, it will make them feel, will make them more real or overwhelming. That the
Mm-hmm.
struggles or the problems will become real. But however, if you talk to a professional or a trusted friend or a person, it will actually help you release emotional burden and gain
Mm-hmm.
clarity in your life.
Yeah, definitely. I think like one of the most common ones that I've heard, even as just a student, is that I know there are a lot of people who are like, okay, well, why are you depressed? Like, what do you have to be sad about? You have like a loving family, friends, you have like a house, a place to sleep. And they're like, what could you possibly have to be sad about when there's so many people who have it worse than you? And I feel like that's definitely like one of the worst ones I've heard because it's just simply not that easy.
Yeah, so as I mentioned earlier, it's a involvement of not just one aspect, many aspects. It could be a neurological problem, it could be a behavioral thing, or it could be just an environmental pressure. So we need to work that out and
Mm-hmm.
look it as a holistic approach, that what
Mm-hmm.
actually would work here.
Yeah, going off of that, how do you think that we can better educate the public about mental health and then reduce the stigma surrounding it?
I think the most important thing here, Vaishnavi, would be educating the public about mental health, right? Many people are actually not aware that what are the mental health struggles and how to go about it, how to seek help. So, reducing the stigma, open conversations, giving them accurate information and accessible resources at the same time.
Mhm.
Also, normalizing these discussions in schools, colleges, workplaces, right? It also
Mhm.
helps in breaking out the misconceptions that we just
Mhm.
talked about. And at the same time, now that social media has become such an important aspect part of our life,
Mhm.
it can again play a very important role in portraying mental health realistically, the real
Mhm.
issues, the real approaches. At the same time, it becomes important that we integrate the mental health education in schools and train the staff, maybe the professionals who are working there. Same for the workplaces where people are working and they have staff with whom they can go and ask and access information from, and accessible therapy options. So I work as a team member at your counseling corner, and me and my friend and colleague. So our aim here is to make mental health support accessible to everyone, ensuring that seeking help is seen as a sign of strength and not weakness.
Mhm.
And that is where accessible therapy options come into practice.
Mhm.
So, our aim is to educate people more and more about how mental health can affect your day to day life and what you can do about it.
Yeah, definitely. I think it's such a weird thing to assume that reaching out and asking for help is a sign of weakness because I feel like having the strength and the ability to be able to go to someone and tell them that you're struggling and open up to them about like the issues that you're facing internally is just the strongest thing you can do
Absolutely.
because essentially like you're trusting someone else with really sensitive and personal information. And
Yes.
so I'm not exactly sure how the misconception that it's like a sign of weakness came about, but I definitely don't think that's the case.
Yeah, I it's hard to understand that way, but because I think it is considered a weakness because of the stigma attached to it
Mhm.
and the
Yeah.
societal pressure and the judgment that goes with it.
Yeah, definitely. So, aside from patients, what would you say is the biggest challenge facing mental health professionals today?
In my opinion, I think there are three main challenges that mental health professionals face. First is the stigma surrounding mental health. It still
Mhm,
prevents many people from reaching out. Second is the rise of social media that has added new challenges, including misinformation, unrealistic portrayals of well being, and the difficulty of differentiating between trained professionals and unqualified individuals offering mental health advice.
mhm,
Because now we can see many people do just one or two online course and they declare themselves as mental health professionals, which becomes very difficult for people to identify that who is the right person to reach out.
especially because that can become very harmful if they give you advice that isn't realistic, and then you follow that advice and it ends up just making everything a little bit worse.
Worse for them, definitely.
And then, are there any specific mental health issues that you have seen increase in recent years?
Uh, yes, post COVID, if we look at, there has been increase of anxiety,
Mhm,
and which have become more prevalent, especially among young adults and teenagers. And I'm saying this with experience because I've been working with university students for the past 4 years now here in UK,
mhm,
and I can see how much they struggle with different types of anxiety disorders. The pressure of social media, academic stress, and uncertainty about the future post
mhm,
COVID contribute significantly to this rise. Depression rates have also surged, as I can see in my
mhm,
work with my students and the clients, particularly during COVID and post COVID, which intensified feelings of isolation,
mhm,
uncertainty, and loss. And another area of concern I can see right now is of eating disorder, which have escalated due to increased focus on appearance driven society, right?
mhm.
Body image issues and the pressure from peers and society and social media. And because of social media, there has been lot of attention that has been gained uh, about PTSD and
Mhm.
trauma related disorders. There is lot of awareness also, but
Mhm.
again, there is not much clarity about the information that is
Mhm.
being seen on social media.
What steps would you say an individual could take to promote mental wellness in just their regular day-to-day life?
As you can read on internet, you can search on it, right? There the steps are same, Vaishnavi. It is how we go about it. But still, to emphasize here, prioritizing self-care, it
Mhm.
is very important in day-to-day grinding of life and
Mm.
all the pressures we go through. We completely forget about it.
Mhm.
So, indulging in activities that bring relaxation and joy, it could
Mhm.
be going for walks, listening to music, practicing mindfulness, or guided relaxation exercises, meditation, exercise being most important, but most avoided by people.
Mhm.
So,
Yeah.
it becomes a very important part here. So, staying physically active
Mhm.
and connecting with others. We
Mhm.
hardly have time to sit down, connect, right? We are so much running in our day-to-day life. So
Mhm.
cultivating some meaningful relationships, reaching out to friends and family regularly or whenever you can, and setting healthy boundaries for yourself
Mhm.
so that you can say no to people, work, and you are able to manage your time at the same time. And with all of this work pressure and everything, we forget about our hobbies and things we used to like doing. So indulging in them. And one most important thing that I ask my clients and students all the time is volunteering.
Mhm.
So when you volunteer, it is very rewarding for your mental health. It gives you a sense of purpose, it improves your self esteem, and it also
Mhm.
strengthens your community connections, at the same time, increasing your confidence.
Yeah, definitely. I think seeing how your work is significantly impacting someone else's for the better is definitely like a really great way of just, I guess, promoting mental health and just making yourself feel better overall.
Yes, because if you volunteer, you gain a sense of purpose, you give meaning to your own life, and at the same time, adding some purpose and some joy into others' life as well.
Mhm. What's one piece of advice that you would give to someone who would be considering a career in mental health?
It would be that is I've been giving to some of the students that I work
Mhm.
with who are interested in psychology, pursuing psychology as their career or mental health.
Mhm.
The person has to remember that helping others start with understanding and healing yourself.
Mhm.
So if you want to consider a career in mental health, start working on yourself so that you can develop a deep sense of empathy and self awareness.
Mhm.
And because mental health work requires understanding other people's struggles, so it is important you do that while maintaining your boundaries and
Mhm.
not overburdening yourself emotionally.
Mhm.
So, here, regular self reflection, self care, and continuous learning become very essential.
And then how would you see the future of mental health evolving?
Mental health of, sorry.
How do you envision the future of mental health care evolving over time with like new technological advancements, new treatments, therapies, things like that?
When we look at the future, it is growing. It is
Mhm.
a very vast growing area where it will become very important part of human beings and
Mhm.
people's lives, right? So if people start coming out to ask for help for personal growth, yes, mental health has a very amazing future and it can help in building societal relationships, growing communities, and a place where everyone is empathetic towards each other.
Okay, perfect. And then my last question for you today is what's one piece of mental health advice that you think everyone should hear?
I would say that healed people heal people.
I love that. That's one of my favorite quotes for now.
Yeah, mine too.
Mm,
Because it is so important to recognize that our own healing journey directly
mhm.
impacts our ability to support and help others. Taking time to heal, grow, and nurturing ourselves definitely improves our mental health, but it creates a ripple effect, right?
Yes.
Where we can see changes in our relationship, and we can see changes in the communities as well. So, prioritizing our own well being,
Hmm.
getting more equipped so that we can offer empathy, support, and guidance to those around us.
I think that's amazing. Thank you so much.
You're so welcome, so much welcome.
Yeah, but that's all the questions I have. Do you have any questions for me?
I would really like to see you working in the field of
Mm,
mental health and creating awareness and doing more work like this. I don't know, I have a question for you right now, but I'm really happy that you are doing this at such a young age